Um, so, Chris, what is the case that, what's the use case here of the patient video case today? What are you going to show us how to do?
So I wanted to use this case as an example of how you can use material in multiple ways. I like to call it toolbox teaching. And the reason I like to think of teaching as a concept in general this way is that instead of getting hung up on, oh, this material is for this topic and I can only teach it in this way, is looking at your material and your um, videos, your writings, and anything like that, and saying, okay, how can I flex this into, my learning objectives for today? What do I have? And as opposed to, do I have to go get something new? So I wanted to show this case, which starts off looking very classically like a congestive heart failure case, but it is actually the patient is diagnosed with chronic obstructive pulmonary disease exacerbation. That's the actual diagnosis of the patient, but I'm going to show you how we flex this into a congestive heart failure case.
Do you come up with a final, the most likely diagnosis? Do you lead them to that through a guided conversation?
So the way we would move is I would usually go around the room and say, all right, let's go ahead and ask about different testing. So what sort of tests do you want? And these are questions that people might know the answer to again. So, I want to test for infection. That's where you would say something like a CBC. And then you have, a complete metabolic panel. And then you can have BNP for a heart failure exacerbation. You can do EKG, chest x-ray, blah, 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 blah. And that's where I like to use the handout that I gave everyone here, where as I go around the room and start revealing lab values and things like that. So for example, we wanted a CBC for this patient. Well, I've made some of my own labs. And so I will go ahead and say, all right, we get a CBC for our patient. And here it is. Here's a complete blood count. And I'll explain. In short, it will look at white blood cell count for infection and then hemoglobin for anemia. And very quickly, I'll say, does anyone see anything highlighted in red or abnormal here? And people say no. It's like, okay, cool. We don't have a systemic response of white blood cell count elevation and things like that. And I would go through results slowly, such as you will see in the handout that I have links to things like I like to look up chest x-rays, and I just create my toolbox that I can share. It's very easy for me to take this CBC, bump up the white blood cell count, highlight it in red, and have it say 20, and find a chest x-ray with a pneumonia and turn this patient into a pneumonia case. It's very easy for me to just take those two things and boom, you have a pneumonia case now. Get a procalcitonin or something thrown in there too. So I would go through all these results, and in the handout, I specifically keep, for this case, a BNP that's separate from my other labs, because all my normal labs are in a kind of a data bank, so that if students kind of throw something at me that's a little off the wall, I just have it there so that I'm not cluttering up my personal note page. I kind of have a separate document for that. You guys all have access to that. So as I go through these results, I just go back and forth and I say, all right, CBC and maybe chest x-ray was normal. So we can reliably take out pneumonia. We can get a D-dimer, and that would rule out pulmonary embolism. And then I would go back and say, because the swelling looks like it's probably on both extremities and that we're dealing with an increased oxygen requirement for our patient, cellulitis is probably not on our diagnosis list. Cellulitis would present more with one-sided redness, tenderness, and maybe some swelling to that extremity or to the area that's affecting. That way you take that student who was thinking cellulitis and they can think about it, they personalize it more. Then you go through the other results. And this process of going through the history, the differential making, the lab result revealing, Everything takes up about 15, 20-minute blocks, because that's around the once again, that's around the average amount of time someone has good attention span for. So history taking and vital sign interpretation, 15 minutes. Differential making and lab test creation and requesting, you're looking at another 15 minutes. About 30 minutes to get to when do I start revealing results. And then the last 30 minutes to 45 minutes, you're revealing results, discussing it, coming up with your final diagnosis. And then the last few minutes, I'm actually talking about the treatment of CHF, COPD, or whatever diagnosis I want to do.